All right, let's continue on the topic about CVA. Okay, what is CVA, guys? CVA is considered as your cerebro. Excuse me, why is it? Okay. CVA is your cerebrovascular accident. Now, why is it called a cerebrovascular accident? So we will have to chop the words from the first one, which is cerebro, which means the head, the brain. Vascular is the blood vessels. An accident is the injury. So this is in layman's term called ear stroke. To be considered as your TIA, it is all about your transient ischemic attack. Pag sinabing transient ischemic attack, you have to take note that it can be resolved or must be resolved within 24 hours, or else it will lead to what you call your stroke. What are the factors or types of stroke, Nurse Jane? Types of strokes could be your ischemic, and another one is hemorrhagic. Your ischemic is divided into two, your thrombus and your embolus. Your hemorrhagic could be it's because of your hypertension or aneurysm that will lead to what you call bleeding. Now, the primary cause of stroke, pag tinanong sa board exam, and you answer what? Thrombus. Pag sinabing thrombus, this is a clot that's immovable. So it stays only on the area, immovable. So that is a primary cause of stroke. While embolus, and when I say embolus, that is all about wandering clot. A wandering clot, kumbaga, mahilig gumala ang kapatid mo, you can call your brother as embolic brother. Yung brother mo naman ng isa na hindi mahilig gumala, gusto niya lang sa bahay lang siya, at thrombotic brother. At mainiting ulo na brother mo, hemorrhagic brother. So, ganun lang. So, let's go with the factors. Risk factors could be modifiable and non-modifiable. So, we'll start with non-modifiable. It could be age, no? Hindi ma-change. Age. So, elderly are prone to stroke. Ano pa ba ang hindi pwede ma-change? This could be genetics or heredity. What else? Sex cannot be changed. Okay, so these are non-modifiable. While the modifiable could be your diet. No, diet, especially if you're gonna have high fat on the diet, because it will accumulate to become your cholesterol. Tataas ang HDL or LDL. Your LDL is considered as your bad cholesterol. Now, so they will become a plaque or a thrombus to the area, then it will decrease the blood flow of the brain. So just to define your stroke in a simple way, decrease blood supply to the brain, and it will lead to what you call stroke. Yun lang. So what are the factors that decrease the blood supply? Thrombus, embolus, hemorrhagic. So yun ang iwasan natin. So what are the other factors that could be for stroke? Number one, atrial fibrillation. Atrial fibrillation, class, this is all about abnormal firing of the heart. When there is an abnormal firing of the heart in the atrial area, there is what you call a development of a mural thrombi. No, magkakaroon ng development ng mural thrombi that will lead to your circulation. So pag there is a circulation tendency, it will impede the circulation of your patients going to the brain. Number two, diabetes mellitus. Diabetes mellitus, class, because of the what? Viscosity of the blood. Viscosity of the blood. So ano mangyayari dyan? Slow ang perfusion or ang circulation. So, ano sabi ko? Decreased blood supply going to lead to stroke. Ano pa number three? Number three could be hyperlipidemia. Mataas ang fats or cholesterol, hyperlipidemia. Number four, smoking as well. Ayan. Ano pa? And the most common cause is your hypertension. Mga hypertension na yan. So, yun ang mga pwede magkaroon ng mga stroke. Hold on. Nurse Jane, I have a problem with regards to this deep vein thrombosis. I heard that this is not a risk factor. Can you tell us why, Nurse Jane, why it's not a risk factor? For the fact that a DVT class, deep vein thrombus, ang thrombus niya ay hindi nakita sa artery. Saan nakita? Vein. So when I define stroke as a decrease in the blood supply, I'm referring not to the vein, I'm referring to the artery. So deep vein thrombosis complication, expect that the patient will be having pulmonary embolism. So just to give you an idea about DVT, there are two things that you need not to be confused. First, pag tinatanong sa board exam about DVT, a preventive measure, then answer in the board exam, please, elastic stacking, anti-embolic elastic stacking. The reason why you need to wear this anti-embolic stacking is to prevent the development of your clot, prevent the development of thrombus or clot. Now, so especially the whole day of teaching, tayo ka lang, upo ka lang din. So dapat naka-elastic stacking ka para hindi magka-develop ng tinatawag na clot. But, may but, avoid using stacking once patient has DVT na. Pag ang patient ay may DVT na, avoid mo na ang paggamit ng stacking. Remember, the purpose of elastic stacking is not to prevent the development of the clot, but the main purpose of it is to increase the venous return. Imagine if you already have the clot, DVT, and you use the stacking, it will lead to what you call an emboli. That emboli will go to the circulation of the vein, going to the pulmonary area. Yun ang tinatawag nating pulmonary embolism. So with this, ang management usually ng mga doctor kasi naka-ventilator na ang pasyente nito, nahirapan na itong huminga. So ang patient will be given a drug called heparin para ang patient magkaroon ng matunaw yung mga clot na namuo. Now, this heparin class is considered as your anticoagulant. Since it is an anticoagulant, a nurse must take into consideration there will be a side effect called a bleeding. No? Bleeding side effect. So heparin shall be given via subcutaneously or intravenously, because the oral form of your anticoagulant is termed as your warfarin or your Coumadin is on the oral form. So, pag oral nga, ang ibibigay mo dito, it's not the heparin, pero ang isasagot sa board exam is warfarin. So, once the patient is taking anticoagulant, take note, avoid eating green leafy vegetables. Why? Green leafy vegetables, class, are high in what vitamin? Very good. High in vitamin K. Vitamin K will counteract the effect of your heparin and warfarin. So avoid using your vitamin, eating green leafy or what else? A vitamin K drug, bawal din yun because it will stop the bleeding episode. It will stop the bleeding episode. But then again, it will counteract the effect of your heparin na instead na matunaw, namuulit. Okay, now, Nurse Jane, ano usually ang manifestation ng pasyente may mga stroke? Well, actually, we will start with this idea. Right hemisphere of the brain, left hemisphere of the brain. This is the right side of the face, the left side of the face, in ito brain, and then this is the body. Okay, your body is divided to right and the left as well. Normally, the function of your right focuses on the what face of the brain. Very good, right then as well. And what side of the body? Left here. So, my right brain function to the right face to the left body. Why Nurse Jane not on the right body? Because if this is your brain, there is a medulla oblongata here, dito nag-cross ang nerve. So, nag-cross ang nerve pa dito sa my brainstem area to be exact in your medulla oblongata. So, ang tawag doon ay decussation of the nerve or innervation, decussation crossing of the nerve. Hindi lang sa brain ang may decussation, pati ang sa mata ha, ganun din ang sa optic nerve mo. Nagkaroon tayo ng decussation. Okay, nursing, therefore, kung sinasabi mo, kung masira si right, the injured area is the right on the brain. So therefore, nursing, ang face na sira is also right. Exactly. And the body is left. Okay, that's it. So we'll start with the signs and symptoms of your stroke. First one, we will be on the brain part. So the brain part, what if the part of the brain that is affected is the frontal lobe? Well, if that is a frontal lobe, on the lobes of the brain tayo muna. So you got your frontal, as what I've told you, a frontal has what you call what area? Broca's area. And this area is responsible for the patient to what? Express. So there is an expression on it. Kaya kung mahilig ka makipag-argue, that is your frontal lobe that is hyperactive. Now, we got your temporal lobe. Ang temporal naman, the function of this one, having a Wernicke's area. So the Wernicke's area responsible for what, Gane? Okay, very good. This is for reception. Or, shall I say, para mas maintindihan mong word na reception, understanding. Now, so if the patient has a problem on the brain, both lobes, for sure on the frontal, the patient will be having what you call aphasia. Ang aphasia dito is what you call expressive. On the other hand, the temporal is what you called, it's what you call receptive. Okay, so frontal, expressive aphasia because the area that is damaged is the Broca's. Temporal is a receptive aphasia. As a nurse, nursing management agad tayo. Anong dapat nating nursing management for every aphasia? Okay, for every aphasia, for the frontal, imagine that the patient is having difficulty on expressing themselves. So what they're going to do is not to finish the statement for them, but allow them to finish statements. To finish their own statements. Very good. Allow them to finish their statements. So, hayaan mo silang ipagpatuloy. Kamusta ka piyo? Okay lang. Karang ganon. So, okay, patient gets ko na okay ka lang. Hindi ganon. Dapat hayaan mo siya matapos talaga. On the other hand, you got your temporal. And the temporal is all about your, understanding. So, the question should be given to the patient can always be answerable by 2 options. Hindi siya yes or no lang ha. 2 options, which means this is considered as your close-ended. Hindi lang siya yes or no ang close-ended. It should be 2 options. Now let's proceed. Nursing, what if both area has been damaged? Most of the area of the brain has been damaged. Ang tawag doon is the Brodmann's area. I don't know if I got the correct spelling. Basta parang siya, global aphasia. Or mixed aphasia. Okay, number 2. So we are done with the brain. Let's proceed now. How about on the part of the brain, Nurse Jane? Part of it is on the, what do you call this one? Yes, on the cerebellar part. Of course, you expect mga patient na magkaroon ng problem balance, kaya nga may paralysis, di ba? Now, what if, Nurse Jane, on the eye area of the patient? Anong meron doon? Very good. The patient with stroke will manifest what you call a manifestation named as homonymous hemianopsia. Ang sabi ko nga sa inyo kanina, hindi lang ang sa brain ang may crossing of the nerve, meron din sa eyes. Example, this is the right brain, left brain. This is the side of the eye, side has side, and this is the brain. And this is the visual field. A visual field is the view that we are seeing depending on what part of the side of the eye is functioning. For example, the right brain will focus on the right side right side pa rin. Dito pa lang siya magko-crossing ang optic nerve. So, the decussation of the nerve happened in the optic area. So, nagkaroon tayo ng tinatawag na right and left function din makikita mo. So, mata, if this is the mata of yours, this is the mata, the right side of the eye of yours, dito oh. So, makikita niya is on the left visual field. Ayan siya. So, kung sila ito, hindi makikita ito. Kaya ang tanong, saan dapat ilagay ang pagkain ni patient if may homonymous hemianopsia? We're going to put affected side, this is the affected, and this is unaffected side. I'm talking about the side, ha? I'm talking about the side. I'm not talking about the field. So since I'm talking about the side, this side is affected and focuses on this side. So where am I going to give the food? Here. Wherein the patient can be seen by the left side of the eye going to the right visual field. Nagkakaintindihan ba tayo? So, in terms of food, guys, there is one instruction that you have not to forget, the word scanning. So, ipagalaw patient, kasi sige reklamo ang patient na, ba't kanilang parati ang ulam po? Wala bang ulam ba ang hospital? Kasi hindi makikita ang other side of the tray. So, tell the, morning. So, tell the patient to do what you called your scanning. Like this, oh, patient, you do like this. Ay, shit, may chicken pala. Let me eat. Ayan. So, the scanning, do not forget on the homonymous hemianopsia. That's the best management that you will answer in the board exam. Okay, the eyes, the right brain, the right side, and the left visual field. Okay, let's proceed to the next one. On the, yes, on the swallowing part of the patient, there will be, of course, dysphagia. Feed the patient where? Unaffected side. Very good. And make sure that it should be a thickened liquid diet ang ipapakain kay patient. Okay, thickened liquid like your porridge. So that is an example of your thickened liquid. Bawal ang mga tinatawag na dark food as well. Baka may mga bleeding na hindi napansin lang because of the dark food. So, dysphagia. Now, nurse, ano pa ang pwede natin tandaan dito? Well, what do you call the paralysis on a patient without stroke? Hemiplegia. Very good. So, pag sinabing hemiplegia, that is a part, side of the body is paralyzed. Side of the body is paralyzed. Now, question. Once the other side of the body is paralyzed, what happened to the circulation on the affected side? Poor or fast? Poor or good? Good ang circulation is not unaffected, pero ang affected is very bad. So, on the patient with hemiplegia, one thing that you need to remember is avoid temperature on the affected side. Kasi mahina nga ang blood volume doon or mahina ang blood circulation. Ano pa pag may hemiplegia? For sure, ang patient na may hemiplegia, may stroke siya, minsan na lang siya gumagalaw. Ano ang turo ko sa inyo pag ang muscle hindi na ginagamit? Nagkakaroon siya tinatawag na muscle atrophy or dystrophy. So, anong gagamitin ng Nurse Jane? Then, teach the patient according to Virginia Henderson to become independent by doing what you called active assistive. Now, ang pagkakaalam ng iba dito sa active assistive, this could be done by the nurse and the patient, which is wrong. Kaya sinabi lang active, that is only for patient. And when you say nurse, that is passive. ROM. Now, ang meron kay patient may stroke, ang dapat mong tandaan is active assistive dahil si patient mismo, for example, this is my weaker side. Si right side ko ang mag-exercise para kay patient. Para, according to Virginia Henderson, you are teaching the patient still to become independent even they are hospitalized. So that is your hemiplegia. What else, Nurse Jane? Since the body is being affected, the cane must be where? On the unaffected side. Okay, unaffected side ang cane, while the nurse will be always on the affected side. Affected side talaga yan si nurse. And ano pa ba, nurse, ang pwedeng lalabas sa exam dyan? Okay, the speech, I forgot, it's your slurred speech. Kanina sa multiple, it's a scanning speech. Okay, ang slurred is on your expressive aphasia. Now, let's go with the medication for this nurse. Well, the meds for that is that first is you need to remember the patient has this injury na rupture, you give your steroids. And as what I've told you, when you say steroids, it will always be given with meals. Okay, with meals dapat because it has a gastric irritant. Now, another one why we need to give steroids because it is an inflammatory, so to prevent edema due to the rupture. Now, what else? You will be given as well a drug called antihypertensive because of the condition na pwedeng magkakos ng stroke, like your captopril or ACE inhibitors. Now, what else? Your anticoagulant. Anticoagulant is divided into two, could be your heparin and your warfarin. Okay, so heparin is heaven, protamine is peace, warfarin is war, and vitamin K is killing. Therefore, the antidote for your heparin class, the antidote for your heparin is protamine sulfate. While the antidote for your warfarin, it's, yes, vitamin K. And both drugs would cause what? Bleeding episodes. So where is the most common area for the bleeding episodes of this patient? Very good. And that is your nose. And what do you call that one? Epistaxis. Epistaxis is the bleeding of the nose. Okay. Once the patient is having bleeding on the nose, what is the best management first aid to the patient? A, lean forward. B, lean backward. Perfect. It should be lean forward. Okay, are you going to pinch the nose of the patient? Yes, we're going to pinch the nose of the patient. Are you going to pinch the nose of the patient? Yes, of course. We're going to pinch. Is it on the bony area or here on the soft part of the bone? Yes, on the soft part of the bone. Are you going to close it? A bony or soft part? Paano ma-press ang bone? I-bone yan eh. Dito lang ako sa taas oh. Pero do not close the nose of the patient. Alright, now, huwag mong ibalik ang blood ha. Hindi old blood na yun. Sayang pa. Okay, next would be what drug are we going to give? A mannitol. Why? This is to decrease the what? Very good. Decrease the, ang galing. To decrease your ICP. And make sure if the patient is having mannitol therapy, urine output could be a best indicator if the drug is effective or not. So once the patient will be having mannitol, expect that there will be a polyuria or normal urine output. Okay, now, what else? The drug to be given. Okay, since the patient is having an injury to the brain, so mag-decrease ang blood supply, so magbibigay rin tayo ng katawag na anticonvulsants. No? So alam mo na kung anong anticonvulsants na yan. And that is your Dilantin. Alright. So that's it. Tapos na. Let's continue. What number are we now? Okay, number 12. Letter A. So TIA defines as resolved in 24 hours or else it will be lead to what you call your stroke. So number 13, when giving the IV phenytoin, which of the following method should be used? The sandwich method. Very good. So ano yung ibig sabihin ng sandwich method? Compatible lang ang phenytoin sa plain NSS. While cooking your... Okay, are the types of the lobes. Your nervous system is divided into two, central nervous system and your peripheral nervous system. Central nervous system is divided into two, the brain and the spinal cord. This one is autonomic nervous system, spinal nerves, and the last would be your esquinita, which is your cranial nerves. Now, when I say brain class, it has divided into five lobes. So it could be your, yes, frontal, temporal, parietal, occipital, and the last could be your limbic system. And when I say frontal, I already told you about the frontal a while ago that this is for the Broca's, responsible for expression. Temporal, this is for what? Very good. This is my life. Vernix. And this is for reception or receptive function. And the next one could be your parietal. A parietal could be your sensation. Kaya pag may problem ka in terms of sensation, mainit na pero nilalamigan ka pa, that is a problem. And the next one would be your, very good, occipital. Occipital is for vision of love. And the last one could be the limbic system. A limbic is considered as your emotion. Ayan na. Okay? Hanggang saan nga lang ang spinal cord? L1, L2. Very good. All right, let's continue. Now, the answer for this one is very good. The parietal. Parietal, well, cooking, we couldn't, parietal lobe, letter C. Number 15. Okay, now we're talking about the ICP. Intracranial pressure 0 to 15 mmHg as the normal um, data for ICP. Having an increased ICP, the cause for this one is what? Commonly, an injury, of course. An injury could be broken or not yet been broken. Because if it's not been broken, you just injured with your head, ang tawag dun ay, everybody say the word, concussion. But if there is already a blood clot, ang tawag naman dun ay contusion. So this both will increase the ICP as well, together with a condition called basilar skull fracture. A basilar skull fracture, as what I've told you already, this is all about the base on the skull. So based on the skull, pag nasira si skull, sinong next na masisira gani? Okay, very good. That is your meninges. And your meninges is divided into three, as I already discussed that one to you. Epi, arachnoid, and dura. And you can find the CSF in your arachnoid. So if the meninges is damaged, the skull is damaged, meninges is damaged, for sure the arachnoid is damaged as well. So expect that there will be what you call a leaking of the CSF. Leaking of CSF, and you know that CSF color is what? Clear. So parang sipon lang yan siya. If that CSF will be on the nose, that is termed as your rhinorrhea. Leakage of CSF on the nose, that is rhinorrhea, while it is otorrhea once it is what you call your bleeding of CSF in the ears. Dalawa yan sila ha. And that eye that is so black, it's termed as your raccoon's eye. No, mawala niya pag mag-decrease na ang ICP ni patient. Now, Nurse Jane, my question is, paano ilalabas sa board exam ang ICP? First could be your signs and symptoms. Number one, if the question is earliest, dalawang klaseng earliest meron tayo, and I would like you to take note of that. This one is considered as behavioral, and the other one is considered as your mental status change. The mental status change is talking about the confusion, while the behavioral change is talking about your restlessness. Now, since we're talking about behavioral restlessness, bakit kaya muna nag-decrease? Bakit kaya nagkaroon ng restless and confusion? Simple lang nga, di ba? Once there is an edema because of your injury, what happened to the circulation to the tissues? Decrease ng circulation. Kaya ang patient, she or he needs to become restless to what? To have an air on the blood. Confused na ka pag hindi ka enough ang blood supply to the brain. Especially wala kay tulog, gano'n, nagkaroon ka ng confusion on it. Now, let's continue. That's the earliest. Another earliest sign could be your ovoid pupil. An ovoid pupil, or shall I say unequal pupil. Bakit unequal pupil, nursing? Because unequal pupil means there is a dilated pupil. The patient is about to, very good, die. So dying patient yan basta may mga dilated pupil. Kasi nga the moment that the patient arrive in the hospital, doctor will get her or his pen light. So anong gagawin ni doctor sa kanyang pen light? Is strike doon sa may pupil. Na dapat pag may light, anong mangyari sa pupil? Mag-constrict. But then again, anong nangyari sa kanyang pupil? Nag-dilate. So ang patient is dying na already. What else, Nurse Jane? What else? Okay. Another one is the projectile vomiting as the earliest sign. Projectile vomiting is the earliest sign of your increased ICP. So since there is a projectile vomiting, after that, you got your late signs. And late could be the most famous Cushing's triad. Okay, if the Charcot's triad is SIN, your Cushing is very good. That is, ano ang Cushing? Yes. Normal triangle. Why? The blood pressure is high. If the pressure and temperature is proportional, so the temperature is as well high. Excuse me. Decrease RR, decrease pulse rate. So these are termed as your Cushing's triad. Take note of that ha, Cushing's triad ang tawag natin dyan. So ang shock is baliktad. Ganito ang shock sa Iron Man, ito si Superman. Now, another thing is you will be having your widened pulse pressure. I want you to understand it very well. When I say widened pulse pressure, this is all about systolic minus diastolic. If the patient is having widened pulse pressure, meaning to say increase ang volume niya. And once increase ang volume niya, increase ang pressure. On the opposite hand, there is what you call a narrowed pulse pressure. Pag sinabi kong narrowed, tendency niya, nagkaroon ng patient ng hemorrhage. So, ang hemorrhage patient lead to what you called shock. Okay? So, pag may shock ka na, ang imong isipin talaga, class, is having a narrowed pulse pressure. Alright. So, pagkatapos niyan, magpunta na tayo doon sa nursing management pag mataas ang ICP. Ano ba ang mga nursing management? Of course, iwasan natin magtaas ang ICP. Avoid coughing. No? Avoid coughing. When you cough and sneeze, you open your mouth. Open your mouth para ma-distribute ang pressure. Now, so when you say nursing management, one of the management as well to the patient is, since the patient is immobile, the patient will be having increase in fiber. Tama, Nurse Jane? Yes po, increase water din po. Okay, ano pa, Nurse Jane? Since ang patient, Nurse Jane, avoid cough and avoid lifting heavy object. How heavy is that heavy, Nurse Jane? Not more than 14 pounds or 7 kilogram. So, ganon. Hindi dapat sila mag-lift ng object, ha? Do not lift heavy, or avoid lifting heavy object. So, that's it. Ano pa? Head always at the central. Always. Head or neck. Okay. Head and neck on central position. Bawal ang mag-side, bawal ang mag-up and down to increase the ICP. And for the position na natin sa board exam, position. And that position is semi-Fowler's or 30 degrees angle. Take note of this one. Any question? Very good. So let's answer now this one. And the answer is your behavioral change. Okay, now, you answered bulging fontanelle and high-pitched cry. Take note, this bulging fontanelle and your high-pitched cry, that is your sign of hydrocephalus. So, hindi mo to siya ma-check if your patient is already a child or a preschool or nasa school age na. Why? Because this is only an indicator for a patient with hydrocephalus. So, ano makita mo lang doon kasi mataas ang pressure sa hydrocephalus, maraming water. Well, increase the pressure, increase to the decrease of blood supply to the area, restlessness, nursing. Yes, correct. Okay, now, there are, if your bone is damaged, especially the skull, if the skull is damaged, remember that there is what you call meninges. And once the meninges will be damaged, tendency the patient will be having what condition? Meningitis. Now, if there is a meningitis in the area, take note of the two causes of it, and that could be your bacterial and the viral. Bacterial and the viral. So, anong pwedeng lalabas sa board exam regards with is the laboratory test. Paano malalaman ang bacterial siya or viral meningitis. Let's go with the appearance of your CSF after doing your blood the CSF analysis or protein analysis. So, in bacterial meningitis, it becomes cloudy na ang appearance. and nag-decrease ng glucose and tumaas ang protein. Bakit tumaas ang protein? Dahil ang inyong meninges is made up of neurons and neurons is a myelin sheath. Ano pakialam namin din yun? May pakialam ka dahil ang myelin sheath is all about your... It's made up of myelin sheath. It's made up of protein. Kaya pag nasira ang iyong myelin sheath, tumataas ang protein level sa inyong CSF analysis. So yun malalaman kung bumaba ba ang bacteria sa meningitis, hindi. So earliest sign of your meningitis, take note of this one, that there will be always what you call nuchal rigidity. When I say nuchal rigidity, this is all about the hardening of the neck or stiff neck. That is the earliest sign of your meningitis. So there will be a test to determine that if the patients really have a meningitis for meningeal irritation by doing the Kernig's and the Brudzinski sign. Brudzinski and the Kernig sign are the sign for a patient with meningitis. So when I say Kernig sign, this is all about the knee that is being flexed. And once it is extended, go back to its extension, nagkakaroon na ng tinatawag na swabbing pagbalik, walang resistance. So since there's a resistance, then there's no Kernig. So once there is a resistance on the buttock, B for buttock, Brudzinski, that is your meningitis. Okay, let's continue. Nurse Jane, ano itsura pag viral meningitis, Nurse Jane? Kasi ano lang sinabi mo? Ang sinabi mo lang ay, ang lang sinabi ko ay ano pa, viral. Pag viral meningitis siya langga, excuse me, ang CSF mo ay clear, ang glucose mo ay normal, and ang protein mo lang ang mataas. Kasi nga, hindi naman pagkain ng virus ang bacteria, hindi pagkain ng virus ang glucose. Kaya hindi mapekto ng glucose. Tapos mo na niya. Okay? Ang pagkain ng glucose ay ang pagkain ng bacteria ay glucose. Kaya sa bacterial meningitis, look at this one, bumaba ang kanyang glucose. Mataas always ang protein, guys. Tandaan mo yan. Pag may problem sa utak mo, mataas always ang protein kasi ang protein na yan is the myelin sheath that covers your neurons. And the correct answer here is positive Kernig sign. And when you check for the gag reflex, always remember, put it in the back of the patient and the patient will feel that there is something, ganon. The gate control theory, I already told you about that. It's on the spinal cord, the anterior, the central, and the posterior. So once there is an increased ICP, number 19, restlessness and your confusion will be a sign of complication of your ICP or complication of injury that is considered your ICP increase. So one of the manifestation of that is your restlessness. And what letter is that? Doesn't behave normally, boy. 20. Concussion, ang tawag naman natin dito is, what we call this one? This is what you call your, ang tawag doon is cohorting. Everybody say cohorting. When I say cohorting, this is the separation of cases to cases. Non-communicable to non-communicable, communicable to communicable. So your patient is having only a fracture class. The patient is having only concussion, nauntog lang. Saan mo siya i-refer? Then, to mga fracture area. Very good. Cohorting ang tawag doon. Same case, same case. May word na first ha. Pag sinabing may first, guys, anong dapat tandaan? Airway ang priority. So, after the break, we will be discussing about your GBS.